Before you pop that pill or take that drug, wait a second. Have you ever thought about how everything you swallow ends up passing through your kidneys? Yes, every single medication. And if you're not careful with how much or how often you take them, it can damage those vital organs. Even those everyday meds in your cabinet can harm your kidneys if you use them too much or at high doses. According to the American Academy of Family Physicians, 20% of kidney damage is caused by drugs. Some common medications might be more dangerous than you think, so let's go over a few to watch out for. But before we jump into that, make sure to like this video and subscribe to our channel for more health tips and information. Are you ready to find out which drugs to be cautious about? Let's get started. 7. NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, like aspirin, Bayer, Ecotrin, ibuprofen, Advil, Motrin, and naproxen, Aleve, naproxen, are the usual go-to remedies for pain and inflammation. While they're household staples and often considered safe, even therapeutic doses can pose a risk to your kidneys. Long-term use of these common medications can lead to chronic kidney disease, CKD. So, what exactly happens to your kidneys with NSAIDs? There are two main ways these drugs can cause kidney damage. The first is through acute kidney injury, AKI, due to reduced blood flow in the kidneys. NSAIDs decrease prostaglandins, which are chemicals that help dilate blood vessels in the kidneys. When prostaglandins are reduced, it disrupts this dilation, causing a sudden decline in kidney function. The second way NSAIDs can harm your kidneys is through acute interstitial nephritis, AIN, an inflammation in the kidney's interstitial tissue. This typically occurs about a week after NSAID exposure due to an immune response. AIN is now recognized as a major cause of drug-induced AKI and accounts for about 15% of all unexplained AKI cases. Despite its prevalence, AIN caused by NSAIDs often goes unrecognized. So, while NSAIDs might seem like the perfect solution for that pesky pain or swelling, it's essential to tread carefully. Always follow the recommended dosage, and if you're using them long-term, keep an eye out for any signs of kidney trouble. 6. Supplements. Dietary supplements have become quite popular lately with people looking for ways to improve their well-being. However, while they may seem harmless, they're not always as innocent as they appear. Unlike drugs, dietary supplements aren't tightly regulated by the FDA. Instead, they fall under the category of food, which means they don't have to meet the same rigorous standards for safety and effectiveness. This can be a bit of a red flag, especially since not all ingredients are required to be listed on the label. Now, here's where things get tricky, especially if you're dealing with kidney issues. When your kidneys are damaged, they struggle to clear out waste products from your body. And as kidney disease progresses, certain nutrients can build up, causing different problems. Take potassium, for example. With kidney disease, too much potassium can be a real issue. That's why it's crucial to be mindful of your blood levels and avoid supplements with added potassium if your levels are high. Researchers have identified 17 dietary supplements like vitamin C and L-lysine that have been linked to direct kidney injury. And to make matters worse, the FDA can't give the stamp of approval on these supplements before they hit the shelves. So while your buddy might swear by that herbal supplement they're taking, it might not be the best idea for you, especially if you've got kidney problems. Long story short, always talk to your doctor before starting any new supplements, especially if you've got kidney issues. 5. Antibiotics. Believe it or not, kidney damage caused by antibiotics is more common than you might think. In hospital settings, it's responsible for about 10% of cases of acute renal failure and 60% of drug-related kidney damage. Who's most at risk? Well, the elderly take the lead here, especially if they already have chronic kidney issues or other health problems. If you're dehydrated or stuck in the intensive care unit, ICU, you're also more vulnerable to kidney damage from antibiotics. So, how do antibiotics cause this kidney chaos? It can happen in a few ways. Some antibiotics like amoxicillin can form crystals that refuse to break down, clogging up your urine flow like a stubborn drain blockage. So, while antibiotics can be lifesavers when you're battling an infection, it's essential to use them wisely and under the guidance of your doctor. 4. Contrast dyes. Contrast dyes are special substances used in diagnostic tests like CT scans, MRIs, and angiograms. These dyes are either swallowed or injected to make it easier for doctors to see any abnormalities in your organs and blood vessels. For instance, CT scans use iodine-based contrasts, while MRIs use gadolinium-based contrasts. While these contrast dyes are super helpful for getting a clear picture, they can also be pretty rough on your kidneys. Experimental studies show that contrast agents can reduce blood flow in the kidney's medulla, produce harmful free oxygen radicals, and even cause kidney cells to die off, a process known as apoptosis. Let's break down the risks for the two types of contrast dyes. Iodine-based contrasts, used in CT scans, can lead to contrast-induced nephropathy, where the dye temporarily disrupts the blood flow to and from the kidneys, potentially causing damage. On the other hand, gadolinium-based contrasts, used in MRIs, can lead to nephrogenic systemic fibrosis, which causes thickening or darkening of some areas of the skin. This is particularly a risk for people who already have kidney disease. Before you get a CT scan or MRI, your healthcare team must check your kidney function. This ensures that using contrast dye is safe for you and helps prevent any potential kidney-related complications. 3. Diuretics. Diuretics, commonly known as water pills, are used to treat conditions like high blood pressure and heart failure. While they're usually well tolerated, like any medication, they can have side effects. And one of them is acute kidney injury, especially in older adults. This is because diuretics work by lowering blood volume, which can disrupt the kidney's filtration process. Now, here's the thing. Diuretics aren't inherently bad for your kidneys, especially when taken as directed. But when doses start increasing, that's when the risk of kidney damage increases. Loop diuretics, in particular, can mess with your electrolyte balance and even cause metabolic alkalosis, a condition where your body's pH gets thrown out of whack. But that's not all. High doses of loop diuretics can also mess with your ears, leading to ototoxicity, a fancy term for hearing loss. There's evidence suggesting that they can mess with your respiratory tract as well, impairing mucociliary clearance and possibly even suppressing your immune system. While diuretics can be a lifesaver for some, it's essential to use them cautiously and under the guidance of your doctor. 2. Acid suppressants or proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are the go-to medications for managing gastrointestinal issues like GERD and peptic ulcers. You've probably heard of some of the common ones, like omeprazole, Prilosec, and esomeprazole Nexium, along with famotidine, Pepcid, and calcium carbonate, a common one being Tums, which are also used to suppress stomach acid. While PPIs can work wonders for taming acid reflux, one of the less common but still significant side effects linked to PPIs is acute interstitial nephritis, AIN. This is an immune-driven response that affects both the interstitium, which is the space between the kidney tubules, and the tubules themselves. What happens is that the tissue cells in the tubules get damaged, leading to an inflammatory reaction with a bunch of T cells swooping in. If left unchecked, this inflammation can spread and scar the renal cortex, which is the outer part of the kidney. That can cause a decline in kidney function over time. PPIs have also been linked to hypomagnesemia or low magnesium levels. Studies have shown that people taking PPIs are twice as likely to have low magnesium levels compared to those who don't. And get this, low magnesium levels have been linked to chronic kidney disease, CKD. So, if you've been popping PPIs for more than a month or relying on calcium carbonate, Tums, regularly for heartburn or indigestion, it's essential to have a chat with your healthcare provider. They can help assess whether these medications are still the right choice for you and explore other options if needed. 1. Blood pressure medications. Angiotensin-converting enzyme inhibitors, ACE inhibitors, and angiotensin receptor blockers, ARBs, are potent drugs for controlling blood pressure and reducing the risk of cardiovascular diseases like stroke. You've probably heard of some of the common ACE inhibitors, like benazepril, Lotensin, enalapril, Vasitec, and lisinopril, Prinival, Zestril, as well as popular ARBs such as azilsartan, Edarbi, candesartan, Atacand, and irbesartan, Avapro. When you're sick, whether it's from the flu, diarrhea, or just not drinking enough fluids, your blood pressure can drop. That drop in blood pressure can also affect your kidneys. Usually, healthy kidneys can handle this and protect themselves. But if you keep taking your blood pressure meds when you're dehydrated or have low blood pressure, it can be tough on your kidneys. The pressure within your kidneys might drop so low that they don't filter properly. A recent study found that a specific type of kidney cell called renin cells plays a crucial role in this process. These renin cells usually produce a hormone called renin, which helps regulate blood pressure. But when things go wrong, these renin cells invade the walls of the kidney's blood vessels and trigger the buildup of another type of cell called smooth muscle cells. This thickens and stiffens the blood vessels, making it harder for blood to flow through the kidneys properly. Long-term use of drugs that mess with this renin-angiotensin system, like ACE inhibitors or ARBs, can have a similar effect. Since ACE inhibitors are cleared out of the body through the kidneys, they also carry a risk of causing kidney injury. So, if you're on an ACE inhibitor, your healthcare provider may adjust your dosage or recommend routine blood tests to monitor your kidney health. Whether your kidney function is perfect or not, it's necessary to talk to your doctor and pharmacist about all the medications you're on. They can help make sure you're taking the right amount at the appropriate times to avoid negative side effects and protect your kidneys. Before we say our goodbyes, instead of just hitting the like button, let's give it a virtual high five. And while you're at it, why not tap that subscribe button for a steady flow of health tips to keep you in tip-top shape? Thanks for joining us.